and welcome to the Association Talking Heads. I feel really privileged today to talk to Dr Valerie Dick, who's the Chief Operating Officer of the Royal College of General Practitioners. It's the membership organisation for over 50,000 GPs, and they work extensively to be the voice of general practice and improve patient care in the UK and internationally. GPs have, of course, been at the absolute forefront of the fight against COVID-19, and I'm really interested, Valerie, to find out about how you as a college have supported GPs from the outset, whether it be the sort of shortage of PPE to the incredible rollout of the vaccine, which we're seeing now. Can you talk a bit about what you've done and the biggest issues you faced?
Thank you, Claire, and I'm really pleased to be here talking today. I think that, as you've said, GPs have been at the absolute forefront of what we as a nation has done to address the issues arising from COVID-19, an unprecedented pandemic. But what it has demonstrated is that GPs can really rally and be on the front line. And it's also demonstrated how well the college has done to support all of our members and the health sector generally. So what have we done as a college? And we've done an immense amount. And I'm going to go through two key things, really. Firstly, COVID-related work, because that's really important, and a bit about our policy and campaigning's work. So, with the onset of COVID and the realization what was happening, we needed to make sure that we could communicate information that was critical and relevant to our members. And so we created a COVID resource hub, and it's the college's e-learning house, and they have a wide range of materials, robustly and quality assured. And this supports GPs and their teams through these difficult times. And at the moment, it's attracted over 800,000 views, and it is still being utilised. Secondly, we've got our members forum to ensure that we respond quickly to members' queries and the concerns about COVID, as well as we've produced wellbeing documents and resources to encourage GPs to look after their own health, because I think that's something that people forget. GPs also are suffering during this time. We've got a major campaign, General Practices Open campaign, and that provided guidance for the public about the new ways of working with GPs as appropriate, because there was a thought that during lockdown, GP surgeries were locked down, but GP practice and GPs are still working and still open. Our chair, Martin Marshall, he does weekly updates on the COVID situation, and this is through college meetings, discussions, and he does this digitally to make sure people know what is happening. We've got COVID-related research and surveillance. This takes place through the RCGP in association with Oxford University Research Surveillance Centre, including the principal trial, and this is all about reducing the duration and severity of the pandemic. So the RCGP is right in there, in the center of this work. And this is providing really high quality workload data. This work is in addition to the work we do, which is ongoing on flu and influenza-like illness surveillance work. But as you can see, switch the work quickly to make sure we can pick up on the work needed on COVID. We have an extensive range of webinars, blogs, vlogs, videos, virtual events, many led by our faculties, which are our local engagement parts of the organisation. And we've got webinar series, which is on YouTube. So again, that's another channel where people can access information. And the launch of our report, which is called General Practice in the Post-COVID World, that was launched last July. We quickly galvanized and said, things are going to change. And how, as we going to be an organization, going to change? And this resulted in over 1,000 emails being sent to MPs, which these emails from individuals highlighted to MPs the greater support for GPs that is and should be in the management of COVID in the community. So we've done a lot of COVID related work as a college to support our members who are out there on the front line.
Valerie, can you tell me a bit about the media campaigns that you've been running?
We've done a lot of policy campaigns and media work, and all of this is because we've listened to the concerns from our members, and we've used this to influence campaigns on a number of areas, and I'll detail a few. We used the findings from our member survey on vaccination to highlight inequities, as I've talked about, on the uptake of the vaccine by Black, Asian and minority ethnic communities. We've also highlighted the bureaucratic obstacle to GP returners working as volunteer vaccinators. The government and NHS England listened to us. They were receptive to our concerns, and they've already been legislative changes allowing returning GPs to administer the COVID vaccine in primary care without having to be on the performance list. So this was a speedy and a tangible victory for our campaigning work. At the start of the pandemic, we highlighted technical infrastructure problems, such as the lack of VPN connectivity, and this prevented self-isolated GPs being able to deliver remote consultations from home. So that is something that we as an organisation, we as a college identified. We flagged members' concern about the lack of PPE, and this enabled them to undertake face-to-face consultation when it was addressed. But again, we, as many with others, said PPE, we've got to improve this. We wrote to the Work and Pensions Secretary to highlight the lack of employment protection for employees who were shielding at home. We did that. We highlighted the risks and issues around patients in care homes. We reproduced and identified and made available to the BMA issues about practices and how they should reprioritize their work during the pandemic. We fed into that. And we successfully lobbied for relaxation of the legislation about the reuse of end-of-life drugs in home care. And there's a whole host of other things. Letters to the University's Minister, Michelle Donnellan, demonstrating the impact of the A-level results issues on prospective medical students. And it helpfully brought the government to do a U-turn, I think. We weren't the only ones, but there was a lot of cry and we were one of them. And we raised our concerns over flu vaccine supplies to manage this year's programme to the English Health Secretary, Matt Hancock. And Matt Hancock, intervened personally to have rapid change. So we are on the front line as GPs. We as a college support GPs on the front line, but we've also done that by providing services for them to access, to support them. But when we listen to our members and they tell us that things aren't right, things can improve, this is just a some, but not all, but some of the things that have been positive to make sure that we are in the midst of a vaccine rollout program, but we made sure that we effectively and efficiently got to this position. And all of us will thank all of the individuals across the NHS and all the organisations supporting them that's making sure that this vaccine program is being rolled out. But as I've said, we're here to make sure that GPs who are central to it are supportive, and they're doing a fantastic job.
They are. I mean, that is just a huge range of different issues you've been involved in, from PPE to A-level students to the vaccine rollout. And I know the number of GPs involved in the vaccination rollout is massive. You're doing, did you say 80% of the vaccination?
70-odd%, yeah.
But it's just a huge number. I mean, the way and the ramifications of your involvement and GP involvement in all aspects of life has just been immense this year.
It has, yeah. And I think that when we look at general practice, when we look at GPs, generally, without COVID being in existence, on a general day in the UK, over 1 million people go to their GP every day. So they're a fundamental part of the health system. And I applaud all GPs, and we should all be thankful that they have done everything to make sure that we as a nation are safe, but they are doing everything to be at the forefront and to work with others collaboratively in the vaccination program.
Yeah, I completely agree, but also thanks to you for supporting them and giving them the framework, the education, the information, the media coverage, the lobbying, which you as an association do. So
yeah, and you are right. If not to say they wouldn't be able to do the vaccination program, but we, working collaboratively with other organisations, have made sure that the Royal College of General Practitioners is seen as an organisation that is positive, supports its members, is the voice of the members, but we're there to ensure the best in patient care. And everything we've done to date during COVID, I think, has been fantastic. So yeah, it's been great.
I'd like to just look a bit at some of those things you've mentioned in a bit more detail. One is actually the pressure which GPs are under. Obviously, even before COVID, GPs were under immense pressure. They've taken on more stress. Are there particular initiatives which you put in place to help their well-being, to ensure we keep GPs from staying as GPs and not leaving? Are there particular well-being focuses which you've initiated?
I think we don't work in isolation. There is the BMA, there are other colleges. We work in that teamwork, but on the whole issue of well-being, we've made sure that we have different areas where GPs, we can point them, depending on what it is that GPs feel they need more support on for their own well-being. There are resources in the BMA and other organisations, and there are resources internally, but I think what we've done is made sure we've got a signpost so that all GPs, if they need help and support, they know where to go. And so we've done that. We've signposted to the right places depending on what the GP needs are.
I know one area which you're particularly involved in. You're the chair of the Equality, Diversity and Inclusion Steering Committee on the Royal College of General Practitioners. BAME members and patients have been disproportionately affected by COVID, and diversity is obviously a huge issue in our society at large. But I'm interested in what you have been doing for your members and to support patients to overcome some of the diversity which we see.
Right, so as you've said, I co-chair the Equality, Diversity and Inclusion Steering Group, and I do that with the Chair of Council, Martin Marshall. But as you've also highlighted, and I think people generally should have heard, that Black, Asian and minority ethnic GPs have felt a disproportionate hit negatively because of COVID, and same is true for Black, Asian and minority ethnic workers in the health service, in care homes, as well as patients generally. This means there's been a disproportionate impact on certain parts of our community. And the impact of COVID on Black, Asian and minority ethnic health professionals and patients, we have listened as an organisation, and this prompted a call for us to contact the Equalities Minister at the time, Kemi Badenoch, for an update on the implementation of the recommendations from the Fenton report. And why we went to the Minister was to say this report had recommendations that should start to address some of these issues, and we wanted assurances that the safety of our colleagues was paramount, and where were we on the progress of these issues. We wrote to government asking for a rationale as to why Black, Asian and minority ethnic patients were not identified as a priority list for the COVID vaccination. If we've got evidence that this element, these areas of society, they are disproportionately being affected, why shouldn't they move up the priority list? So we wrote to government about that. And we called on the government for a public campaign to address the low vaccination uptake amongst Black, Asian and minority ethnic communities. The analysis that we've done in the college shows that over 90% of people vaccinated so far have been white. So the campaign is running, but the issue is, why has there been such a low uptake? And if we knew why from government, then we could be a part of the solution to address that. And we're currently in talks with the Care Quality Commission about the impact of inspections on BAME, Black, Asian and minority ethnic GPs, because we have a Black, Asian and minority ethnic action plan, and that action plan at the moment is being delivered through 5 task and finish groups. And those 5 task and finish groups have got Black, Asian and minority ethnic GPs, as well as our officers, as well as our staff from the RCGP on them. And we've been listening to what those individuals have said. And so we have taken on board the feedback. We're a listening organisation and we're doing things to address that. So there's a number of things we've done, but we're not doing it in isolation. We're listening to the GPs and we're taking action which is appropriate for us as an organisation.
I mean, those figures, that data is really shocking, isn't it?
I think the data that I've just read out to you is something that has been provided to us and it's been collated, and that's why we've done what we've done. If this is true, why is it? And if this is true, what can we do to address and help to change that?
Do you feel as your role as an association that you're spending more time lobbying government with this kind of information than you have done in the past?
We've always lobbied government. I think it seems as if we've got a higher presence and a higher voice than before, because the news over the last year has been skewed to what is happening with COVID. But no, we've always lobbied on issues about the numbers of GPs, about workforce, about all sorts of issues. So one of our roles is to be the voice of GPs. You've got hundreds of thousands of GPs, lots of GPs and clinicians, but we've got 54,000 members, and what we want to do is to be the voice for those members, and these things, whatever they are, of concern to them, we lobby to government. Yeah.
So just going back to the data side and those numbers, obviously you're listening. Are you also collecting data to present to government? I mean, is that part of your role, or other people doing that? I think
if we're true, we do get some data, but our focus at the moment has to be dealing with COVID, GPs on the front line, making sure that they're delivering what is required for the rollout of the vaccination programme. But there are organisations who are in a better place to collect those data. It is their role, but we've got data for ourselves as well, which we use in some of the information, but we're not the data collection statistical organisation. Government has a lot of data and other organisations have a lot of data, and we use that.
Technology, though, every organisation has had to go through an amazing acceleration of their use of technology, and that's certainly true for GPs. They switch very quickly to virtual appointments. And I'm wondering how you as a college and talking to your members feel about that. I know it's been embraced, but also there's some criticism of that. Do you see virtual appointments as the way of the future, or more of a hybrid model?
I don't think we've had a major debate to say, oh, right, we're all going to be having digital appointments. I just think that At the moment, they are virtual. And as we ease out of the pandemic, it will continue to use virtual, but at no point has anyone said, right, we're going to come out and just do virtual GP appointments, not at all. And many individuals still obviously do face-to-face. It's less than we used to do more than a year ago, but I don't think the future is going to be, at this moment, from what I understand, is going to be just virtual meetings, or even to say that it's going to be half and half. So, the hybrid you talked about, I think it will always, at this moment, from what I can see, still have face-to-face, but we might still use the telephone for triaging or just getting some details. So that's not the change. I don't see there's a major change, but there is still a major debate to be had, but that isn't the priority at the moment as for a debate.
It was very impressive the way that they did switch so quickly to virtual appointments.
I think the issue is that before the pandemic, GPs were using telephone contact to discuss with patients. So the switch was amazing, and I think you're right, but it wasn't a sudden, oh, we've always seen everybody face to face. GPs sometimes had other methods to interact and consult and liaise with their patients. And as I've just used the phone. So it wasn't an unusual, but I do commend every GP that rallied and was in a position to change really, really quickly. It's been really, really effective, very effective.
I mean, it's been an incredibly challenging year. I mean, I think particularly for anybody on the front line, but there have been some positives. Looking forward, where do you see the positive changes which have happened over the last year moving forward? What would you like to take forward?
As an organisation, I think that we were on a digital transformation journey before the pandemic. And so that just demonstrated we were on the right road. So as an organisation, I talked about the webinars and the vlogs, etc. All of that we could quickly switch on because we had decided as a part of our strategy, as approved by our council and our trustees, that we should be invested in the digital transformation. We did that, and that's why when we had to, all staff, clinicians, everybody couldn't visit the offices or had to work now remotely, we already were equipped with laptops, etc., whereas other organisations I know said they had to order 700 laptops or 200 laptops. We were already on that road. So that was the first thing. I think, so it's the digital agenda was really important. I think that the equality, diversity and inclusion agenda, the college had already started to do work on this well before the pandemic, and we were starting to look at these issues. So when the call came from our members, from the general public, from the media, saying what is happening with COVID and the impact on Black, Asian and minority ethnic individuals, whether staff, people who worked in the clinical field or patients, we already had started to understand that difference, treatment and the impact of that treatment on certain groups in society had already come into our force. So we knew this was happening. So it wasn't a surprise. So I think what going forward, we need to build on that new way of working. We need to build on the information and make sure there is real change for all of those individuals impacted, not just from the Black, Asian, minority ethnic community, but all of the other groups who face different treatment because they're a part of, whether it's on the gender, disability, age, whatever it is, that we pick up that mantle and make sure we have change and action on that.
I really hope that continues as well. That's a really great thought to finish on. Valerie, thank you so much for your time, and well, thank you for all the work you do for GPs. We all benefit and appreciate it. Thank you.
Thank you.